That's just, all right, acute HIV infection. When patients come in, remember acute HIV infection, couple of weeks after exposure, flu-like syndrome, headache, meningeal symptoms, rash, maculopapular, lymphadenopathy, absence of coughing, sinopulmonary symptoms. Think acute HIV infection. You're going to do what? Get what test? Viral load, PCR, right. All right. Review their medication list. You also want to discuss substance use and mental health screening. A lot of PrEP, you do have to refer patients for mental health screening, substance use screening. So that's part of when you implement it, looking at it. If you don't have the services on site, referring to your community partners, I think can be helpful. Get the information from patients in their own language. What does PrEP mean to you? Some people think, I think it's just the morning after pill. I just have to take it, a dose before. No, it's one pill daily. And what's also important is that willingness to adhere to PrEP. My personal preference for PrEP is that it's folded into primary care. It's a great way to not only discuss other prevention measures, but think about meningococcal vaccines, HPV, immunizing against hepatitis A and B. And then partner information, you really want to determine the status of the partners. Again, if they see a bottle of Truvada and they don't disclose that they're on PrEP, the assumption may be, I'm HIV infected. And what does that mean if a partner or spouse should discover that? So definitely domestic violence screening. Anybody that has unstable housing or poverty, it's going to be difficult to onboard them. But we've had patients in shelters that we've started successfully on PrEP. I'm going to go over some of the insurance issues with PrEP, but really most of the time it is covered. And then the reproductive plans for women. Serodiscordant couple. That means one's positive, the other's negative. Okay? Let's say the man's positive and the woman's negative. And they want to have a kid. All right? So the man's positive and the woman's negative. Well, you can send the man to get his sperm washed, right? $10,000. And then you can do IVF. Boy, that's very expensive. But the CDC also recommends HIV positive partner, put them on antivirals, get their viral load to undetectable. That'll happen. All right? Then a month before any conception attempt, the woman starts on PrEP. Remember we said it takes about 3 weeks for the cervical vaginal? Well, they give an extra week buffer. He's undetectable. She's been on PrEP for at least a month. Now they can have conception attempts. Once they conceive, there's the option of having the woman continue on PrEP, or you treat the last exposure as PEP and she continues for just 1 more month, but then they don't have any more encounters. That's been widely used. No transmissions. All right, so some of the language that helps. So the pill Truvada has 2 drugs in it that are commonly used to treat HIV in persons who are HIV positive. When taken daily by people who are negative, they can block HIV from infecting the body. The pill needs to be taken every day in order for the body to build up sufficient drug levels to block. It cannot be expected to work if it's only taken just before, just after sex. And PrEP reduces but does not eliminate HIV. One case report, Toronto, a Canadian on PrEP. They were able to determine that he was taking it daily. He had adequate drug levels. The person that he was exposed to had multi-drug resistant virus, which happens, and PrEP wasn't enough to prevent the transmission. So again, it's not 100%. That was one case out of the thousands now that have been on it. But again, you want to counsel patients, introduce the whole thing about sexual health, condom use, and all that. So educating patients on how PrEP works in language that they can understand. Efficacy is really dependent on adherence. You do need daily dosing. And what they say is at least a week of daily dosing, then 2 weeks for rectal. So for men who have sex with men, it really at least 2 weeks, or God, give me a week and a day. And for women, it's going to be at least 3 weeks. And if you stop PrEP, after about 3 days, the levels dip. By 5 days, it's gone. So really, if you should interrupt your therapy for more than 3 days, you want to start that rebolusing daily for at least a week to bring you back up. All right? And there's other things you can do during that time, like condom use. Tim and I were speaking a little bit about it. There's this one patient, he was on PrEP, so obsessed, his insurance was interrupted, and he was like, oh my God, what do I do? What do I do? I can't access my medication. I said, well, how about just have safe sex and condoms until we can sort this out? So again, bringing them back and incorporating all of those other prevention strategies, I think, is really important. It's very well tolerated. Most people don't even know that they're taking a medication. They may experience some headache, abdominal pain, and weight loss, but these are very short-lived, maybe within the first couple of days, but extremely well tolerated. There has been safety now about PrEP use. So again, that 1% drop in the bone mineral density doesn't seem to translate into increased fracture risk. So there's been data to show that. PrEP is not, though. You have to really be engaged in care. You have to see your provider every 3 months. And I'm going to give you the recipe for that. And then PrEP isn't for lifetime. I mean, you're going to discontinue definitely if they do seroconvert, if they do develop renal disease, if they're not adherent, or if their life circumstances change where they no longer need it. We spoke about acute HIV seroconversion. You have to be really adept at identifying that, having a low threshold for that. We're very bad at detecting acute HIV infection. Remember, persons in acute HIV infection are up to 1,000 times more infectious. They're going to go to your health department, ED. They're going to test negative on the antibody test. Maybe if you have a more sensitive 4th generation, you may be able to pick it up a little earlier. But again, if you're concerned about early infection, signs and symptoms, what are you going to get? PCR. All right. And then for women, there are benefits. All right. If a woman is pregnant, if she has been exposed, you can do post-exposure. If she's at ongoing risk, after you rule out HIV, you can put her on PrEP. And again, there has not been a signal for teratogenicity with tenofovir or emtricitabine. So this is how you do it. So baseline or pre-prescription lab test. You want to get an HIV test. You want to get the more sensitive, either at least a 3rd or a 4th generation test. And you're going to perform PCI or viral load if they've had any risk within the last 6 weeks. You just want to get that basic metabolic panel, make sure their serum, creatinine clearance is above 60. A urinalysis just to rule out any pre-existing renal issues like Chagas. You ever seen that one? And then serology for hepatitis A, B, and C. The reason you want to do that is that if they're not immune to A or B, immunize them, right? And then for C, if you should identify them, you can refer them for treatment. And then you got to do STI testing, and you got to do the 3 sites: pharyngeal, urethral, and rectal. The majority of asymptomatic STIs are pharyngeal and rectal. People are going to know if they have gonorrhea of the penis, burning, pain. But if you got gonorrhea rectally or chlamydia, oftentimes it's going to be asymptomatic, and we know that that can enhance HIV transmission. So you got to do all sites. 3-site testing or where they've been exposed. That's where the sexual history comes in, and you got to feel comfortable saying, do you have sex? Yes, men, women, both. Are you insertive, receptive? So that's important to ask, because then that's going to tell you where you need to test. And I don't think a lot of us are doing pharyngeal or rectal too much, but we should. And then a pregnancy test, right? Not that it's contraindicated, but you want to know so that you can counsel women about, potential benefits versus risk. And the last thing that I also want to say is that you really want to consider vaccinations. Importantly, HPV. If they're under the age of 27, wow, what a great vaccine that's going to avert cervical, anal, oropharyngeal cancers, right? Data's already showing that in Australia, where the uptake has been huge, right? If it's a day before their birthday, if you give them that first dose, insurances will cover the 3. That is, I think, the most important vaccine, HPV. So do that in your young men and women. And then meningococcal, if they're at risk, MSM. All right, so this is the way you do it. PrEP is not a month with 11 refills. So the first thing you're going to write them for is 30 days, right, after you've ruled them out for HIV. So you're going to do these tests, say, hey, I'm going to call you in a week, or I want you to come into the office in a week. At that 30 days, you're going to say, hey, how's it going? You're adhering. And then you're going to write them for 60 days, right? So a month with the refill. And that's going to bring you to 3 months. And then it's rinse and repeat. All right? So the first day, right, you're going to do the baseline test, make sure they're HIV negative, bring them in. 1 month, have them come back. Then 2 months, that'll bring them to 3 months. And then you have to see them every 3 months. And the important test to do every 3 months is the HIV test. If they're positive, take them off so that they don't breed deep resistance, all right? And then offer them HIV treatment. So this is the menu. So for HIV testing, you're going to do that every 3 months. If you think they're an acute HIV infection, PCR, viral load. Okay, sexually transmitted infection, you're going to do that every 6 months, even if they're asymptomatic. Hepatitis C screening annually, baseline and then annually. Renal function is going to be done baseline 3 months and then twice a year. Urinalysis annually, and then pregnancy testing every 3 months. So let me just put it this way, okay? Every 3 months, you're going to do HIV testing and pregnancy testing, okay? Every 6 months, you're going to check kidney function, okay? And STI screening. And then annually, basically a urinalysis and a Hep C if they're at ongoing risk. And that's it.